When I grew up in Reynolds, Georgia, we used Reynolds Pharmacy for our prescription needs. Leonard Watley was our pharmacist. He worked 6 days a week, closed on Sunday, but if we were sick or needed medicine on Sunday or even at night after hours, he would drop what he was doing and meet us at the drugstore to meet our needs. I know Jimmy Smith and John Pennington did the same for the folks in nearby Butler in our county. In my home county, I know that kind of service is still happening with Jonathan Knight at Knight's Pharmacy and Bobby Bazemore at Smith's Pharmacy. There are real advantages to living in a small town. Prescription medicine would be one of them. When we moved to Warner Robins about 22 years ago, we started using the big box stores. We learned quickly there's a vast difference. My guest today is George Launius, a retired independent pharmacist and pharmacy owner from Madison, Georgia. He will talk to us about what goes on behind the scenes these days in the world of pharmacy. You will learn what is going on affects our health and the very fabric of our lives. George will shine a light on how Big Pharma's influence can lead to soaring medication costs, restricted access to affordable drugs, and a focus on profit over patients, ultimately challenging the health and well-being of the public. Maybe you already know all of this. If not, like me, you will be enlightened. A local pharmacist speaks.
Viewing life from a hearse, it could be worse. Laugh, think, and cry with the country undertaker.
This is Bruce Goddard, and you're listening to the View from a Hearse podcast. I have with me my friend George Launius from Madison, Georgia. George, thank you for joining us here. I appreciate you getting on here with me to talk about something that I think people are going to find interesting and very educational. So thank you for doing this.
You're welcome, Bruce.
George, I've known you through my brother mainly for a long time. I know you've been a pharmacist in Madison for almost 50 years. I know you're retired now, but I know what we're going to be talking about is this whole country's health system and our pharmacy industry, and we all know recently in our news there's been concerns about health insurance, and people are confused when insurance companies deny or delay medical procedures, and that's certainly true in prescription drug coverage, and I know you're an expert on that. So before we start, I want you to take a moment and just tell us a little bit about yourself so people can know who I'm talking to.
Thanks, Bruce, and I appreciate the opportunity to be on your podcast and to reach out to some of your listeners. Just briefly, I was born and raised in small Georgia town, Monroe, right between Atlanta and Athens. My life there was probably very similar to your life in your hometown of Reynolds, Georgia. Just like Reynolds, we all knew each other. There were no shopping centers, just Main Street stores, small merchants. And we actually had 4 independent pharmacies in downtown Monroe back in the 60s when I was a child. By the way, only one of those stores is still in business today. So, we just enjoyed good old small town service. The pharmacists knew our names. They knew our families. We didn't wait in line. We didn't have to call in our refills ahead of time. It was just a wonderful life and a wonderful way to have pharmaceutical services. My childhood was typical for those times. We lived in the town, and we could ride our bikes wherever we wanted to go. We were watched by our neighbors and friends, so it was just a very wonderful life. After I went to pharmacy school, my wife and I, Nancy, from Macon, Georgia, settled in Madison, where we were able to own an independent pharmacy.
Okay, before you get into Madison, how did you decide to go to pharmacy school? Tell me about that.
Well, I was lucky enough to get a job as a shoulder jerk at one of the local pharmacies in Monroe. And gosh, it was the best job in the world because I came in right after school and I got to make cherry cokes and ice cream and floats and things like that. And
Those things are gone by the wayside, right?
that's right.
Yeah.
Definitely gone.
Yeah.
But anyway, I didn't work in the prescription department, but I noticed that the pharmacist was always greatly respected and everybody knew him and seemed him or her enjoyed their work. So it made me think that maybe this was a great profession, and it truly was. I studied pre-pharmacy at Georgia Southern for 2 years and then went on to UGA for 3 years of pharmacy. Back then, the degree was a Bachelor of Science. Didn't have to have an entrance exam, just had to make good grades, and I was lucky to get in. And of course, that's where I met your brother, the famous George Goddard, also known as Chicken George, from one of your podcasts.
Yep.
Your brother and I are still good friends today and speak often on the phone. And of course, also at Georgia, I met my wife from Macon, Nancy.
So you talk about Chicken George. You and him are both pharmacists, obviously. Both of you are retired, but you and George have done some traveling together in your days back in the day too, right? Hadn't you been on some trips with George?
I have, and of course, I was very fortunate to participate in the Chicken George golf tournament in Reynolds, Georgia.
Nothing like it, was it?
In fact, I think I might have, I know I have a trophy that I found, and I might have won an award for the shortest drive because my drive off the tee hit a mailbox that had scorecards in it and bounced back. So I got that going for me, Bruce.
Folks, you think he's kidding, but they did give awards out for the shortest drive. They had all kind of awards. You talked about you went to Georgia to pharmacy school. You met Nancy. You guys came back to Madison, Georgia. So how'd you end up becoming an owner of a pharmacy? Tell that story.
Well, I was very fortunate. The two guys in Monroe, one a pharmacist and one a non-pharmacist, who were childhood friends of mine, wanted to open a store in Madison. They saw an opportunity. At that time, Madison only had two pharmacies, both downtown, both excellent pharmacies run by wonderful people. But these two guys felt like there was an opportunity. Madison was growing. So they opened a store in downtown Madison called Thrifty Mac. And I worked at that store. And after a short period of time, I saw the writing on the wall that I really wanted to become an owner. And I approached these two men, and they were very, very nice and receptive. And they put a price out there, and I was able to borrow the money and buy the store. And that was in 1976, so a long time ago.
Yeah, 48 years ago, right?
That's right.
And you sold it recently, I suppose, when you retired, right?
I did. I sold it to a very, very wonderful family from Bainbridge, Georgia, the Reynolds family. Their son, Griffin, has taken over in my place. Reynolds family is highly respected in Bainbridge, and they have 4 stores in that area. And so they have taken my store and just done a super job of maintaining my customer base and upgrading the store. So it's a match made in heaven. The people are just wonderful, top shelf people.
You know, one of the things I remember, and as you know, I've been in your store a couple of times. You had all those big green eggs. You were like one of the bigger dealers of the big green egg, wasn't you?
It's funny how that all happened, Bruce. My wife and I fell in love with Big Green Egg smoker grills, and we went to Atlanta, and we went to the only place you could buy a Big Green Egg, which was off of Claremont over there close to Peachtree DeKalb Airport. And Ed Fisher, who started Big Green Egg, sold us an egg for our home. And my wife, who's never met a stranger, got to talking to Mr. Fisher and said, we've got a retail store. We'd love to carry your eggs in that store. Do you have any kind of program for that? And he told Nancy, yes, I do. And so, make a long story short, we became the first retail dealer for Big Green Eggs in the world back then, and we still sell them in our store today. And of course, Green Egg is worldwide now.
I had no idea you were the first dealer. I just remember because I'm a green egg cooker. I've had 3 of them. I just remember seeing all the green eggs, all the grills in there. I had no idea you were the first dealer. Man, you can listen. That's big news right there. You can include that in your obituary one day.
Well, it's been fun, and Mr. Fisher, believe it or not, Mr. Ed Fisher, who's in his 90s, still owns the Big Green Egg Company and has just done a great job with it. He's got a great product. He comes and visits us occasionally, and so we call him a friend, and it's been wonderful.
That is unbelievable. I had no idea I was going to get that answer to that when I asked you. Let's go back. You were talking about growing up in Monroe and just a small town, and you didn't have to wait. Just talk a little bit now from your perspective and owning a pharmacy for 48 years. How has pharmacy and medicine changed since you first started running your drugstore?
Well, back then, we typed the labels with a typewriter. There were no computers. We counted the pills with a counting tray. Prescriptions were all handwritten by the doctors. They did call in some, but most of them were handwritten. And the people went to the doctor, and he'd handwrite 2 or 3 prescriptions, hand them to the patient. The patient would bring it into the pharmacy, hand them to the pharmacist, and wait while it was filled. And usually no one waited more than a few minutes. It was just a pleasure to work like that, and there was no insurance companies. There was nobody telling us that we couldn't fill something or that we were filling it too soon or that we were, it's just a wonderful way to work, and the people respected us and appreciated what we did. And I guess the best part was back in 1975, 76, when I started, the average price for a prescription, and remember, there was no insurance, but the average price for a prescription, whether brand name or generic, and of course, most things were brand then, was somewhere around $5. So it's nostalgic to think about how little we paid for things. And it was very uncommon for folks to take more than a handful of drugs. Nowadays, we've got patients taking 15, 20 different medications.
How do the prescriptions come in? All through computer? And how do you count the pills? Just briefly tell me what's going on with that part of medicine, pharmacists now.
Well, even though there are still pharmacists that count with a counting tray, the majority of pharmacists now have some technology to help them count. That the prescriptions, for the most part, come in electronically directly from the doctor's computer to the pharmacy's computer. It comes in and appears on a screen. Believe it or not, we still catch lots of mistakes that come in that way because doctors choose the drug off a list off his computer, and sometimes he'll get in a hurry and pick the wrong drug, or he'll pick the wrong quantity or pick the wrong directions. We have directions that say take 1 tablet twice a day at 9, 12, 4, and 8. And so you see that's confusing. So the pharmacist is really a gatekeeper for these errors that come in, even though they're electronically sent to us. Now, very few doctors actually handwrite a prescription. Most of them come in electronically or they're printed by a laser printer. But as far as counting the medication, most pharmacies now have technology that counts the pills optically or some way. It also verifies that it's the right medication, it's the right quantity, and that everything is correct. So even though there are still some pharmacies with a counting tray, most don't count that way anymore.
Yeah, that's interesting. I was thinking that when you were saying that if doctors wrote the prescription, there'd tend to be less errors than it is if they choosing a button on a computer, right? I'm sure errors coming from the doctor increased, right?
That is absolutely right. When doctors would write a prescription on a piece of paper or what we would call a prescription pad, it's very seldom did they make a mistake. But when they went to this electronic thing, the errors went through the roof, and it was up to the pharmacist to catch these errors, which we're proud that we did. It's very frustrating for us, but it's just part of the changeover to the digital world.
Before we get into this, what's going on behind the scenes and all that. Talk a little bit about, fast forward to today, about what's happening in the world of pharmacy education and what opportunities for young people interested in pharmacy. Has that changed, or what's your thought on that?
Well, America went through a pharmacist shortage a few years ago. The chain grocery and big box stores were expanding at a record pace. In response, many new pharmacy schools were open across our country. In fact, Georgia went from 2 pharmacy schools, which was University of Georgia and Mercer, to a total of 4 pharmacy schools, adding Philadelphia College and a pharmacy school in Savannah. Unfortunately, in recent times, pharmacies are closing in record numbers. It's estimated that 10 pharmacies close every day in America.
Wow.
So we still think pharmacy is a great profession, but we highly encourage these young people, both men and ladies, to learn more about pharmacy, to go and actually learn what the opportunities are before they go into the business, thinking that it's a high-paying job. In fact, a lot of the jobs with the chain pharmacists are very stressful. The chain pharmacists do not give the pharmacists the support that they need, the ancillary help that they need, and so it can be very stressful. So right now, enrollment in pharmacy schools is down 60% across America. I just encourage people before they make that decision that they need to do their due diligence. Unfortunately, Bruce, we find this in a lot of professions. You hear a lot of doctors say they wouldn't be a doctor again. Nurses say they wouldn't be a nurse. Teachers saying they wouldn't be a teacher. It's everywhere.
Right.
But these young people just need to think twice before they jump into something.
I go to Publix, my wife and I do, and it is so frustrating, the Publix pharmacy. We moved from CVS, and which was terrible. It was a nightmare. I mean, you wait forever. Nothing was ready. I go to Publix now. I get these texts. I go pick up everything. 2 minutes later, I've just got back home, and I get another text saying you got more medicine. I'm thinking, why in the heck didn't they tell me that when I was in there? And then they don't know your name. They have no idea. They're always, it's hectic. It's scary when they're giving you medicine, and I don't know anything about medicine, but it's scary because I know they're in a hurry. I know they got pressure on them. I know they're trying to see how many prescriptions they can fill in a day. So in layperson's term, I'm certainly a layperson. I just take medication. That's all I do with it. But explain what's happening behind the scenes and the challenges in pharmacies in America today.
To give a little background to that, one of the challenges in pharmacies is there are so many pharmacies closing because they've lost profitability. Walgreens is closing 1,200 stores, CVS 900. Rite Aid just exited bankruptcy and went from 5,000 stores to 1,300. And of course, the small independents are closing left and right. But what's going on in the background that scares me is very simple. The big corporate Americas, they measure these stores on a system called metrics, where they tell the stores, you're doing this many prescriptions a day, you're giving this many vaccinations, you're doing this and that. And so according to our computer, you can have 1 pharmacist and 1.5 technicians. Well, what's frustrating for the public and for pharmacists and for everybody is that there's literally more people working behind the counter at Starbucks than there is behind the counter at the CVS, and that's scary because this medicine is way more important than coffee, and it's a sad situation today, and fortunately, most of the small mom and pop independent stores that are still out there do operate with more people working behind the counter. They operate with by giving their employees lunch hours and time off, and they don't generally work late at night or on holidays or Sundays. And so it kind of follows the tradition of Chick-fil-A, and that is they take a day off for their religion and they take a day off to rest, and they don't look at the corporate greed that we have with all the other, big chain stores.
I also know that as this is happening with the lack of help and the big corporations, that they've got PBMs, You need to tell me exactly what that is, pharmacy benefit managers, but that really has changed a lot about what's going on in pharmacies, right?
That's correct. And in fact, if your listeners have watched the news or are reading the news, they may notice that in the past few months, the Federal Trade Commission, the FTC, has issued 2 reports concerning the PBMs. And let's talk about what PBMs are.
Okay.
PBMs are pharmaceutical benefit management companies. They're a middleman. And they started out processing prescriptions 30, 40 years ago for the insurance companies because insurance companies needed a middleman to handle that task. All they did was they would make sure that the prescription was billed properly, and they paid the pharmacy a fee for that, and they charged the insurance company for the service, and they charged just a small fee, a small percentage, or a very small amount of money. You know, they've changed a tremendous amount, but again, the PBMs are, I'm not going to say are causing the problem, but they're mostly causing the problem we have in America with frustration of getting pharmaceutical services. And I want to go into more of that when you're ready, Bruce.
You go right ahead.
Let's talk about what they do. The first thing, they enter into contracts with all the pharmacies in America. And because they're so powerful, their contracts are one-sided. They are take it or leave it. There is no negotiation. When they send a contract, even to big stores like Walgreens, there is no negotiation. The PBM says, I'll pay you this for each prescription, and they can take it or leave it. The PBM knows that if the pharmacy, such as big as Walgreens, whatever, if they don't take the contract, there are other stores that will. So the PBMs, they set the price, that they set the money that the pharmacies paid. They set the price that the patient pays. And those are known as copays. So when you go to the pharmacy and they charge you $10 for a prescription, that's set by the PBM. So they affect every prescription, just about every prescription in America, and they affect just about every American citizen. There are a few people that aren't affected by the PBMs. There are 6 major PBMs, but there are 3 really big PBMs that control 80% of the prescriptions filled in America. And these PBMs are part of the insurance industry. So I'm going to give you the names of them.
Okay.
The one that most people will recognize is called CVS Caremark. And it's owned by, of course, CVS, and they own Aetna Insurance. And so another one that's big, it's been in the news lately, is United Healthcare. They own a PBM called Optum. And while they don't have retail pharmacies, they have a huge mail order pharmacy. And then the last big PBM is called Express Scripts out of St. Louis, Missouri, and they are owned by Cigna. Now, you see the writing on the wall. The insurance companies used to hire these people to do their prescription drug claims. Now, the people that do the prescription drug claims own the insurance company. So they're extremely, extremely powerful, and they spend a ton of money on lobbying, and they have really got the power. And only in recent times have the PBMs come under scrutiny from the FTC. So right now, the revenue for the PBMs for big 3 are in the billions of dollars. They are ranked number 4, number 6, and number 16 on the Forbes list of largest public companies. To get a better illustration, these 3 PBMs each, they're as big as Apple, Amazon, and Walmart, and they are bigger than Ford, GM, Bank of America, and Home Depot. That's just a brief example. These guys are big.
So how did that happen? It started off as a good thing. I mean, it sounded reasonable that they had PBMs. They needed help in handling these prescriptions, but it's just gone haywire. It's almost like a monopoly, right?
That's right. In fact, I was just telling Nancy the other day that it kind of reminds me of the old thing we used to have back in the 30s and 40s called the company store, where you work for a company and they would give you certain amount of currency that could only be used at their store. So they not only made money as with
Right.
you being an employee, but then they made money when you went down and bought bread from them at their store. Well, that's the way these PBMs are. They own the insurance company and they own the retail pharmacy. So they fix it where if Bruce Goddard has Aetna insurance, then he is encouraged monetarily to use a CVS pharmacy. So you see, it's a mess.
A couple things. One, it causes us to pay a lot more for medicine, and it also, we may be getting not the latest medicine because of all their manipulation. Is that right? I mean, we may not be getting the right medicine that we really need because they're controlling it because it's more profitable.
Let me give you an example, and I think this will clarify it. The PBMs are so powerful now that they will go to the insurance companies or to people that are self-insured, like say General Motors or whatever, and they'll say, we'll handle your prescription drug claims. And what they'll do is they'll go to the manufacturers and they'll say, well, we have 20 million patients under our umbrella. And if the doctor orders a certain medication, let's say he orders an inhaler for your asthma, they will demand that the manufacturer give them a kickback or a rebate for that inhaler. If the manufacturer refuses to give them that kickback or rebate, then they don't cover it. So that goes back to what you said. The doctor may order what he thinks is the best medicine for his patients, but the patient can't get it because the manufacturer isn't paying a rebate to the PBM. Now, if the manufacturer does pay a rebate to the PBM, where do you think they get that money? They just charge more for the medicine.
Right.
So, and who is really punished by this? It's the government, because our government provides medication through Medicaid and Medicare. So they're really getting the raw end of the deal from these PBMs. And most people have no idea that a PBM gets a kickback or rebate from a drug manufacturer. And let me make sure everyone knows this is absolutely 100% legal under the current law in America. So this happened a lot when I was in business. A doctor would write a prescription for a certain type of insulin made by Eli Lilly in America. And Eli Lilly was not paying a rebate to the insurance company. So the insulin got switched to Norvo, which is a Denmark company. So all of a sudden, the patient is confused. Why am I getting my insulin from Denmark? I would rather get an American-made insulin. Well, sorry, but the PBM determines what they're going to cover and what you're going to get. So it's really a eye-opening scenario.
When they first started doing the kickbacks and the rebates, but wasn't the intention was to pass it on to the customers, the people like me, but that doesn't happen, right?
Of course, the PBMs say it happens, but in reality, it's just smoke and mirrors, and it's very hard to determine if you're a company, a small company with say 300 or 400 employees, and you've hired a PBM to manage your prescriptions, and you ask them, would you give me a list of all the medications that you provided and how much you paid the pharmacy, how much you charged me for it? The PBM they'll lawyer up and say, I'm sorry, that's proprietary information. I can't give you that information. So it's not as transparent as it should be.
Right.
Now, there are smaller PBMs that are transparent. These big guys are just so big and so powerful. So, one of the things that a lot of people have never thought about, but there have been brand name companies that have said, we're going to lower the price of our brand name drug to try to help folks out, or to meet the needs of Medicaid or whatever. And the PBM will drop that drug from their formulary, because if they lower the price, the rebate gets lowered. It's no longer profitable for the PBM to cover that drug, they'll look for a different drug. So there's an incentive for the price of the drug to be higher in order to benefit the PBM.
So what happens, customers are getting nailed to the wall, as you mentioned, the government, who's really taxpayer, is getting nailed to the wall by what they do. And haven't I heard Trump, when in his campaign, and you hear so much stuff, I may have missed it, but hadn't he talked about this, the middleman, that this needs to be fixed? Have you heard that, or is that something I dreamed?
No, I think that is in process. In fact, the FTC did a report. I talked about this earlier. Did a report a few months ago that proved that the PBMs were overcharging, and then they were costing the government and consumers a lot of money. You and I are talking in the middle of January, and they just released another report by the FTC critical of the PBMs for wasting money for HIV, cancer, and heart drugs, expensive drugs. The way they do this is your doctor puts you on a kind of an expensive medication, let's say, for cancer. You go to get it filled, and the pharmacy says, I can't fill that. Your insurance company says you must get it only through the mail. So you get it through the mail. The mail order pharmacy is owned by the PBM. The mail order pharmacy charges an extraordinarily higher price because they have no competition. They can charge whatever they want. So the FTC has found out and proven that they are wasting money by following this method of restricting access to these high-priced medications only to their mail order pharmacies, or they also call them specialty pharmacies.
Right.
But it's really frustrating, and I think the new administration is going to look at it. But unfortunately, the head of the FTC under Biden will be leaving, and someone else is taking over under President Trump. So we hope that they'll continue the fight.
Yeah, so that'll have to go to Congress to change the laws, right? That's how to get fixed.
And there are bills in Congress to change the law, but things move slow in Congress.
Right, for sure. So you mentioned earlier these pharmacies going out of business, and obviously this stuff you're talking about is what's causing it. Folks, I'm talking to George Launius. He's a retired pharmacist, owned his own pharmacy in a small town, America, in Madison, Georgia, for 48 years. We're going to be right back, and we're going to continue talking about this. Okay, George, as I said earlier, you'd mentioned that you got many pharmacies now going out of business, and I know you just kind of, I can read between the lines to see why they're going out of business because of the benefit managers. So just talk a little bit about what's happening with them going out of business and why that's happening.
Well, Bruce, I think it's real simple. When they lowered the price of milk, dairy farms in Georgia went out left and right. If you can't make money, if you can't cover your expenses, then you can't be in business. And that's what's going on in pharmacy. Even the big pharmacies, the Walgreens, the Rite Aids, the CVSs are closing stores left and right. There's just no profit or very little profit left. And so the PBMs control that, and they know what they're doing. They are purposely sending out contracts to pharmacies where the reimbursement is less than what the drug costs. So I remember, I've been retired 2 years, and I can remember filling prescription. The drug costs $1,000 and I'd get $950 for that drug. Well, how am I supposed to pay my help and pay the light bill? So I want to give you an example of something that's very eye-opening. In 2011, Walgreens refused a contract with the PBM Express Scripts. They said it was ridiculous. They weren't going to make any money. At that time, Walgreens had 8,300 stores, and they wanted to negotiate a better reimbursement with Express Scripts. Express Scripts simply said no. And so they dropped Walgreens. So you had thousands and thousands of people that would go to Walgreens for their medications, and they had Express Scripts, and they couldn't get their medication. So Walgreens thought that this would pressure Express Scripts and include them in their contract and to give them a better rate. But it backfired. The patients simply just moved their prescriptions to CVS, Rite Aid, or to any pharmacy they chose. And within 6 months, Walgreens had lost over $1 billion. And so they had to go back to Express Scripts, and they had to ask to be included in the contracts. And as you can easily see, if 8,300 stores can't negotiate, then how can one little store in Madison, Georgia, or Reynolds, Georgia, or anywhere, how can they negotiate? Well, they can't. There is no negotiation. You cannot take one word out of that contract. So it's terrible.
You were talking earlier when we first started about I guess I was talking about the service in a chain pharmacy is just lacking, and you can see everybody's frustrated by it. I have to admit, I think Publix is better than CVS, at the lake where I get my medicine. But talk about why that is. Tell me what's going on with the service level, especially these big chain pharmacies. You talk about the private guys got plenty of help, and Starbucks has got plenty of help, but you go in these big chain pharmacies and there's hardly no help, and people stand in line. Just talk about why that is. I think you have, but let's be sure we cover it.
Well, I think it comes down to big corporate greed. It comes down to the old common spreadsheet where they're looking at that pharmacy and they're looking at that location and how many prescriptions are you filling and how much are you, what is your profit levels, and they determine how much personnel they put in that pharmacy. And obviously they don't put enough. And that's frustrating for the pharmacist. It's frustrating for the personnel that work there. They get fussed at by people because their medicine isn't ready or they've come a day early or whatever. And so I've even heard that one of the major chains told their pharmacists and their employees not to answer the phone in the pharmacy.
Right.
I mean, that's ridiculous. And the only way they could deal on the phone was at the end of the day, they would listen to the voicemails and return calls to the patients. Well, as well as I do, the patients may not be at home by then, or they may not be available. And it's ridiculous. And so this also leads to frustration in the pharmacy education department. You've got pharmacy school students who say, I don't want to work in this environment. I don't want to work somewhere where I have to be behind all day long, or I have to fill a certain number of prescriptions before I can have some help. And speaking of that, there have been pharmacists known in America to have to wear a diaper to work because they don't have time to go to the bathroom, which is not in the pharmacy, but on the other side of the store. So it's a lot going on that people just don't know about.
And the other thing is, if you've got not enough help to start with, and then somebody calls in sick or doesn't show up, then which happens. If you're running a business, it happens. That makes it worse. I mean, you get all kind of frustrated people. I'm telling you, I've sat in line for 45 minutes in a outside in my car at a CVS, and I'm certainly, it just has to be that CVS. I'm not trying to blame every CVS, but one I was going to was awful. I can just tell you that. So let me ask you this. There's a lot in the news about people complaining about being denied medical procedures or certain prescription drugs. They deny it because of these benefit managers. Just talk about that. Can you explain what's going on with that?
Well, a lot of medications today are very expensive. And I don't really blame the insurance companies or the PBMs for wanting to make sure that the medication is needed. But as we've heard on the news and as I've seen, it becomes a delay. The doctor writes a prescription for something for you. You go to the pharmacy and they say, I can't get your insurance to cover it. We're going to have to talk to the doctor. The doctors now almost all have one or two people in their office that do nothing but call the insurance companies, fill out paperwork, trying to get medications for patients. So it's just a stall tactic, and it's on the positive side, the PBMs want to make sure these prescriptions are not being filled fraudulently. But there's so little fraud. I mean, the big chain drugstores and even the mom and pop stores, they don't have time for fraud. They just want to do an honest day's work, and they just want to get the patients the medication they need. It has turned into a situation which you and I both talked about. What happened? What unfortunate thing happened to the CEO of United Healthcare a few weeks ago, where he was murdered, and all of a sudden it brought to light the fact that people are upset with the insurance companies making huge profits while they're being delayed to get their medication.
Well, you mentioned the FTC report earlier about PPMs, and they're to blame for these issues going on with pharmacies in America. Have you to talk more about that? Tell me about what they're saying.
Bruce, I think the best way to talk about that report is to just read a little bit of the report, and I've got that in front of me.
All right, do it.
So I'm going to read that now. The Federal Trade Commission published an interim report on the prescription drug middlemen industry, and that's the PBMs we talked about, that underscores the impact that the PBM managers have on accessibility and affordability of prescription drugs. So there they are. They mention right there having accessibility, and they talk about the affordability or the price. The interim staff report, which is part of an ongoing inquiry launched in 2022 by the FTC, details how increasing vertical integration, and when we talk about vertical integration, we talk about the fact that the insurance companies and the middleman, the retail pharmacy, and the mail order pharmacy are all owned by the same corporation. That's vertical integration. So the vertical integration and concentration has enabled the 6 largest PBMs to manage nearly 95% of all prescriptions filled in America. This vertical integrated and concentrated market structure has allowed PBMs to profit at the expense of patients and independent pharmacies. The FTC's interim report lays out how dominant pharmacy benefit managers can hike the cost of drugs, including overcharging patients for cancer drugs, said FTC chair. The report also details how PBMs can squeeze independent pharmacies that many Americans, especially those in rural communities, depend on for essential care. The FTC will continue to use their tools and authorities to scrutinize the dominant players across the healthcare markets and ensure that Americans can access affordable healthcare. The report finds that PBMs wield enormous power over patients' ability to access and afford their prescription drugs, allowing PBMs to significantly influence what drugs are available and at what price.
Wow.
They can have dire consequences, which nearly 30% of Americans surveyed reported rationing or even skipping doses of their prescription medications due to high cost. The interim report also finds that PBMs hold substantial influence over independent pharmacy by imposing unfair, arbitrary, and harmful contractual terms that can impact independent pharmacies' ability to stay in business. And Bruce, that goes back to what I said a while ago. They send a contract out to an independent pharmacy. They say, take it or leave it. The pharmacy takes it. They lose money. They don't take it. They lose patients. It's a lose-lose.
Right. Unbelievable.
So PBMs are part of a complex, vertically integrated healthcare conglomerates, and the PBM industry is highly concentrated. This concentration and integration gives them significant power over the pharmaceutical supply chain. So I'm going to stop there. I think I've pretty much covered it. There's a lot more to this report, but basically we summed it up. Their contracts are unfair. Their PBMs are watching out for themselves. Profit over patients is a good way to say it. And they're going to limit access to low-cost competition.
Why hasn't the government done something about this? What's your thoughts on that?
My thoughts are the fact that they live by the PBMs live by the golden rule, and those who have gold make the rules, and they are extremely wealthy, extremely powerful. They spend tons of money on lobbying, and I think it's going to be similar to what happened with the cigarette business in America and the lawsuits.
Right.
It's going to take a long, long time, but eventually the government's going to have to do something, because here is where the biggest problem is. You and I are both from rural towns, and what's been happening for the past 20, 30 years, the chain pharmacies comes into, say, a town like, we'll use Reynolds, Georgia, for example. They come in Reynolds, Georgia, and they buy up the little mom and pop stores, or they put them out of business. And then all of a sudden times get hard for the chain pharmacies, and they close that store in Reynolds, Georgia, because it's just a small store. It doesn't do a big volume. Now you've got Reynolds, Georgia with no pharmacies.
Right.
Now, you can close restaurants and we can survive, but in rural Georgia, when you start, or rural anywhere in America, when you start shutting down patients' access to care and to their medication, what it leads to is more hospitalizations, and that's the last thing we need in America. We need patients to get their medicine, to take their medicine on time, and to prevent getting put in the hospital, because that's where the big money is.
Is there anything going on at the state level in Georgia with all this?
Georgia is very fortunate that we've got a few pharmacists that serve as a state capital, and they've been able to pass laws to help us stay in business a little longer. An example that we're dealing with right now is when people are told by CVS that they must use CVS mail order. Well, we have a law in Georgia that says you can't tell someone that they have to use mail order, or you can't tell someone that they have to go to a CVS. But guess what, Bruce? The law's on the books, but the big corporate PBMs don't always obey the law, or they dwell on people's ignorance of the law, and so it's just a problem. Now, in last year, we determined in Georgia, and this is breaking news in Georgia, that the independent pharmacists were paid at a much lower reimbursement than the chain pharmacists for prescriptions filled for state employees. And state employees would include school teachers and highway workers and administrative workers in the state. Guess who is the PBM that handles the state of Georgia? Well, it's CVS Caremark. So when the independents learn that when a school teacher in Georgia takes a prescription to CVS Caremark, the price of that prescription is generally much higher, affording CVS Caremark a much larger profit than it would be if they went to an independent pharmacy. We found one example where the independent pharmacy was reimbursed $1.50 for a prescription that the CVS store was reimbursed $23.50. It's the exact same prescription, exact same patient, exact same drug, exact same doctor. So right now, the pharmacists of Georgia are working closely with the governor, closely with the head of the Department of Community Health, and we're trying to get this remedied. But it's not an easy fix, because there are contracts that are in place that have all this set up, and there's nothing we can do. We can't break the contract. So we're hoping that we'll get this fixed pretty soon. But you can see it's just not right, Bruce.
Yeah, it's not. And, it explains where we started at the beginning talking about your big green eggs. You have to sell that other stuff to pay the bills, right? You got to do something to make money, because you're not making it on the pharmacy side.
That's right. And if you think about, Bruce, you go in any store that you normally go into, whether it be to get groceries or to get hardware or lumber or whatever, and for the most part, every item that comes through that cash register has a profit built in. That's the American way. That's what we all live by, everybody in America. it understands that when they buy a cup of coffee at Starbucks, the Starbucks has it marked up, and that pays for the employees and it pays for the benefits and things like that. But pharmacy is a totally different world because the pharmacy has not got the ability to determine their profitability. It is set by the PBMs.
You have no control over what you charge for or any of that. That's unbelievable. Unbelievable. Let me ask you this. For people listening to this like me that it really didn't realize all this was going on and don't know what's going on, but what advice do you have for people like me? Where do you go to get good service at a pharmacy? Just tell me what we should do out here.
Well, I think you personally and I have already know the answer to that, and that is we seek out a independently owned pharmacist and we go talk to them. They'll be more than happy to help to talk to you and look at your insurance and see if they can take it, what your copays will be, and you might be pleasantly surprised that while you think the big box store is going to save you money, it may be just the opposite. But you're not going to find out if you don't go in and have a face-to-face, talk to them, show them your insurance card, show them what you take, and just compare. I use my store that I sold to this day, and I know that I can call and get help and get things done right away. And so I encourage people to give the little guy a chance. You don't have to change to him, but at least go talk to him.
One of the things that I can promise you about you as an owner, and this is going to be true for, I bet you, 98% of every independently owned pharmacy, your number one thing was service. You were concerned if Miss Betty that you see at church every week was waiting 15 minutes. You saw her there. You were doing whatever you could to serve them better. That was your mode of operation, right?
Yeah, absolutely. In fact, a lot of people don't realize that independents are so concerned about not giving good service or not giving a good price that a lot of times they underprice their cash prescriptions, the ones that they can make a little money on. They'll be cheaper than the big box stores simply because they don't want to lose a patient or a customer. These people are their friends, and they're constantly, seeing ads on TV, and they're constantly being pulled away from the small stores. I could give you example after example of where patients were paying $10 for me, and maybe they were out of town and they needed to get their medicine, and they went to a big store somewhere and paid 4 and 5 times that, and they were shocked to learn that. Uh-huh. So, the lowest price isn't what you think, it's what is in reality. You need to ask questions and talk to your small town pharmacist and learn more about this.
Yeah, I can tell you, I get very frustrated whenever I have to go pick up medicine in most cases, and it's just it's very, very frustrating. And I know I'm not blaming it on those people behind the counter. They're working their butt off. I can see that, but it's this whole system that if they're that busy, is my medicine right? And it's just a little bit scary. George, this has been incredible conversation. Is there anything that we didn't talk about that you want to say before we get off here?
One other piece of advice that I meant to say a few minutes ago, and that is a program that we offered in my store that most independents offer. That's a fabulous idea, and it doesn't cost one penny. And that is get your prescriptions lined up so they all come due at the same time each month or every 3 months, however how often you get your medicine. We call it synchronization. Most small independent stores will offer this service at no charge. So therefore, if you get a 3-month supply of medicine, Bruce Goddard doesn't have to go to the pharmacy, but every 3 months he picks up all his medicine at one time and he's done. Right. And so I highly recommend people look into that if they don't already have that set up.
Wow. George, thank you so much. This is great stuff, man. Thank you for your expertise and thank you for sharing this with us.
Thank you, Bruce. Thank you for having me.
This has been much fun. Thank you, man.
Viewing life from a hearse, it could be worse. Laugh, think, and cry with the country undertaker.